Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's episode, I will be talking about GERD. GERD is also known as gastroesophageal reflux disease, and for some people they simply call it acid reflux. So what is GERD? GERD happens when the muscle at the end of your esophagus does not close properly. So when this happens, the content of your stomach kind of leaks back or reflux into the esophagus and causes irritation. Alright, so when the muscle at the end of your esophagus does not close properly, it causes the contents of your stomach to leak back, to reflux back into the esophagus, and it does cause a lot of irritation. So when that burning occurs in your chest due to the reflux of the stomach contents, because it's mostly acidic, it can cause heartburn. Alright, so a lot of people do taste that fluid, like the stomach contents in the back of their throat, and sometimes it can make you seem like you have a sore throat. Alright, so if you do have the symptoms, you likely have GERD and you should get it checked out. Alright, some people do have GERD without having heartburn. So yeah, definitely, you can have other symptoms, but you don't have to have heartburn for it to be GERD. Alright, so other symptoms of GERD include trouble swallowing. As I said, like some people may experience like just a sore throat. Alright, dry cough. A lot of people cough, especially at nighttime. It's a dry cough, especially when they lay down. And then some people have asthma symptoms as well. So, we can have GERD as children, we can have GERD in infants, we can have GERD as adults. It's just important for you to have the appropriate diagnosis and treatment. And if it's not treated, or if it worsens, it can lead to other health problems. And so that's why you need to see your primary care provider for the accurate diagnosis and treatment, because you may need some medication or even surgery in some cases. Alright, so a lot of people, lifestyle changes will help their GERD. A lot of people, lifestyle changes will do that trick. So lifestyle changes include limiting the amount of spicy foods that you eat or acidic foods that you eat, because they can trigger the heartburn. Alright, and then limiting or avoiding alcohol. Alright, limiting or avoiding alcohol, spicy foods, as I said, fatty foods, acidic foods, eating smaller meals. So instead of having like 3 large meals, you want to probably split into 6 smaller amounts, 6 smaller amounts. And then you try to lose weight if you're obese or overweight. Alright, that would help. And also wear loose fitting clothes as well, so that you don't constrict your stomach area. Alright, wear loose fitting clothes, eat smaller amounts of meals, and do not eat late at night. Alright, do not eat late at night. So please try to avoid eating very late, and also when you do eat, you want to stay up and not just lay down immediately after eating. Alright, so yeah, so as I said, those are the symptoms of GERD. Some people have dry cough, some people have asthma symptoms, trouble swallowing, and some people have that sore throat that I mentioned before, and some people have the heartburn. But some people do not have heartburn if they have GERD. And then so in terms of diagnosis, there's a combination of taking your medical history, symptoms, and all that by your primary care provider or a specialist, which is a GI, gastroenterologist, might be able to diagnose you and help you out if you have GERD. And then we have different types of diagnostic tests that we can do. We have upper GI tract x-ray, like an x-ray of the upper GI. They can do an endoscopy. So we do have colonoscopy, meaning colonoscopy goes from the bottom, but endoscopy goes from your mouth. So we have endoscopy, and then we have the x-ray of your GI tract, as I mentioned. Some people can, some doctors will say you should go get a barium swallow, and then we have pH probe study as well. All right, so those are the types of diagnostic tests that can be done, and as well as the doctor asking you a lot of questions about your health, asking you questions about your symptoms, when they occur and how often they occur, and all that can give like an appropriate picture of what is going on with you. All right, so in terms of treatment varies. As I said, most people they can just do lifestyle changes with what I mentioned before, and they will see significant improvement in their symptoms. And some people, they will need medication, right? Some people may need medication to help them, and so it's important for you to know that some people, lifestyle will work for them, and of course a combination of lifestyle with medication. So we do have medications, we have PPIs, we have Pepcid, Prilosec, we have Zantac, we have Toms. Some of them are very good, and some of them, like Toms, some people just take it as needed if they have, whenever they have symptoms. But then some people have Prilosec on a daily or Pepcid on a daily. All right, so it all depends on the severity of your GERD and what your treatment plan is. All right, so yeah, as I said before, you definitely want to make sure that you follow up with your healthcare provider, because some people do have very bad symptoms, and it can really get worse for some people. So some people do have symptoms that kind of like mess with their daily activities, mess with their daily lives, and it makes them very sick when they have GERD. Yeah, so the risk factors for GERD, some people believe that some doctors believe that if you have hiatal hernia, you may raise your chances of having GERD. All right, so if you have hiatal hernia, all right, and then as I said before, vomiting, coughing, straining, sudden physical exertion may raise your abdomen or your belly and can lead to hiatal hernia. So you have to be very, very careful with that. Alright, and as I said before, being obese, being overweight can be a risk factor. Pregnancy, yes, that's a big one. Pregnancy is a risk factor. And then gastroparesis, which is delayed emptying of your stomach, can be a risk factor as well. And then if you have diseases of connective tissue such as RA, which is rheumatoid arthritis, scleroderma, and lupus, it can be risk factors as well. Alright, and of course smoking, you want to quit smoking if you are a smoker. You want to avoid alcohol intake if you drink alcohol. You want to avoid things that are spicy, as I mentioned before, things that have fatty foods. You want to avoid fried foods. You want to avoid coffee, things like that. All right, large meals, yes, you want to avoid any smaller meals, as I said before. And please do not eat late into the night. And then, that should be able to help you. So as I said before, the most common symptom of GERD is heartburn, which is acid indigestion, but some people don't have the heartburn, they have other symptoms as well. Some people feel like the food is coming back into their mouth, leaving a very acidic and bitter taste in their mouth. All right, and then some people, they have that burning, pressure, pain in their chest area, and some people actually feel that they're having a heart attack, but it's not a heart attack, it's acid reflux or GERD. All right, so a lot of people mistake the acid burn pain for the pain of heart attack or heart disease, and but there are differences, as I said, so you really want to be careful. All right, and those are the things that you should be aware of. Treatment is pretty much what I mentioned before, cutting down on lifestyle changes, and then as I said, some people may have to be put on antacids, some people may be put on H2 blockers, and then the PPIs that I mentioned before, and we'll go into that right now. So antacids is like you're taking like medication, and And so you pretty much want to neutralize the acid in your esophagus and stomach so that you can stop the heartburn when you take antacids, okay? And so yes, you can take antacids, and you can also take H2 blockers. And for example, we have Pepcid as an H2 blocker. We have Tegamet. We have Pepcid is also known as famotidine, and we have H2 blockers. Pretty much they do the same thing. These medicines block H2 blockers, which help block acid secretion in the stomach. All right. And then we have PPIs. So PPIs are proton pump inhibitors, and they are like the Prilosec that I mentioned before, and which is omeprazole. We have Prevacid, we have Nexium, we have Protonix, and those are the PPIs. Okay, and then we have some other medications as well. But diet and lifestyle changes go a long way in helping people that have GERD. All right, it helps to lessen the symptoms of GERD. Diet and lifestyle change is very important. So avoid foods that can trigger your GERD. Avoid foods and beverages that can trigger your GERD. Try to eat slowly. Do not eat too fast, and try to split your foods. Instead of large meals, you want to do smaller meals. And also you want to chew your food properly before you swallow the food, and you stop smoking, stop drinking, elevate your head. Remember that when you eat, you have to stay up and not lay down immediately after eating. All right, and stay at a healthy weight. If you're obese or overweight, wear loose clothing, because as I said, you don't want to put any pressure on your belly area, or the lower part of your esophagus, which is what I said before, that it may not be closing properly, and that's why the acid contents go back, reflux back into your esophagus, and cause a lot of irritation. Alright, so as I said before, there are different levels to GERD. Some people have very minor, and some people have very severe GERD. So it all depends, once they do the diagnostic test, as I mentioned before, the upper GI, X-ray series, the endoscopy, pH testing and all that, they will be able to determine how bad your GERD is. And if you have severe GERD, surgery may be needed for that. Okay? Alright, so please follow up with your primary care provider, follow up with your specialist, which is a gastroenterologist, GI specialist, because you want to get it under control as fast as possible, because GERD has complications. Sometimes GERD can lead to a lot of serious complications like ulcer, esophageal ulcer, esophageal stricture, Barrett's esophagus. That one is common. Barrett's esophagus, when acid reflux changes the cells in the tissue that lines your esophagus, that is what you get. Alright, and this condition is linked to a higher chance of esophageal cancer, and we do not want that. Alright, so you can also develop lung problems as a complication of GERD. Alright, because as I said, once the reflux starts reaching the back of your throat, it causes a lot of irritation and pain. From there, it can get into your lungs, which means that you aspirate, and then it may affect your voice, and it affect your chest, causing congestion, causing nasal drip, causing like lingering cough that you keep coughing and coughing and coughing. It just causes endless possibilities for you. You can even develop pneumonia. Alright, so as I said, GERD can limit the daily activities or mess with your daily activities if it's not controlled. Yes, it can, and it can cause your life to be changed. So please understand that proper treatment is advised, and you should please follow up with your healthcare provider or GI specialist, gastroenterologist, to help you so that you can feel better. I hope this helps, and I'll catch you in the next one. Please share this topic episode with your friends and family, and hopefully if you do have GERD, you find relief once you talk to your primary care provider or specialist, and try lifestyle and diet changes and see if that would help you. Take care of yourself, continue to stay well, stay safe, and I'll catch you in the next one. Bye bye.